How'd you get stuck with that job?
Not
I'm
even
sorry.
married.
Not even married. Yes, sir.
Okay, so here we have our liver right in that little space there. It's a little dried out. It's green. It's the gallbladder. So it is on the inferior surface, but it's the gallbladder. Bile is green, so it stains green.
Okay, got it.
Somebody else will see? Okay. We come out here, and he's huge, but his spleen. So, but left upper quadrant it's tongue-like, it sticks down there. Sometimes it can come close to the appearance of the liver, not in him. But there's the spleen.
I'm sorry.
Number one son. Okay, so look right, well, before I go there, I raise the liver, there's the stomach.
What's that, the stomach? Oh.
Behind the liver. His pancreas is back behind there. So this is a little structure called the lesser omentum, but it'll be gone soon.
So don't worry about that.
It'll be gone soon. Okay, so if I come back here, retroperitoneally, tear the lesser omentum, get back. It's always the harder. See how I should approach that. So, back behind here is the pancreas. Which is right there. Ooh, he's nice and big. I always think the pancreas is looks like lean ground beef, kind of chewed up. That big wide thing between my fingers,
And it's behind what?
behind the stomach.
Okay.
So it's fairly nondescript. You know, you rely more on pictures, but it is here. Behind the stomach again. It's retroperitoneal, so it's back there with the kidneys. So up here is all this yellow and clearish stuff. This is the greater omentum. So this drapes right across there, right across the abdomen, just like in us. Actually, he was pretty, he's, he looked like he was in fairly good shape. So he could carry out a fight real well. The greater omentum is going to cover, again, our abdomen, behind the abdominal wall, so most of this is often greater omentum. So it's a lot of fat and lymphatic tissue. It's that's what you're seeing is mostly the fatty tissue, and we all have it. Okay, so I get back, move this out of the way, clear up some of this. I'll just tear this off right now, just to make it easier to see. And this hole, like a worm, big worm, this is all the small intestine. You don't have to know the 3 parts in the cat. We'll do that on the human models. So behind the greater omentum. Okay, so okay. So if I take the small intestine and spread it out, see, the yellow are lacteals. So the yellow is lymphatics, the red are arteries. So this clear wrapping here is called the mesentery. Attaches the small intestine to the posterior wall of the abdomen. So then we have a large intestine also, and again, sometimes it's guilt by association. So we come down here, we look, what's heading to the rectum?
That's a descending, right?
Yes. This is a large intestine. So the ascending and transverse aren't very big in the cat, but there's our large intestine. And look where we're heading back towards. Heading towards the portal. And then we have a mesocolon. Remember, we had mesentery on the small intestine. We have mesocolon, which is the connective tissue. So there's our mesocolon. So question down here, the big question is colon or mesocolon? Mesocolon is, if it's not just plain thin connective tissue, it's fat. Some of these are, just fatty, these layers. Like I say, he was lean. He was look at that. Yeah, not just that, the way he's developed. So I can come back here, poop. I haven't removed anything, but there's my kidney, his left kidney. Which is retroperitoneal, behind the parietal peritoneum.
Is it behind the spleen usually?
Yes, always. Okay, so if we come in here, so if it's a kidney, and you can see right there, I just point the fat on him. He is very lean that way, so if he has a deficiency, his kidneys are they're overly large, and they're not well insulated. So it's common to have a nice layer of fat surrounding the kidneys to hold them in place. That's a normal part of health, I guess. So I'm going to come here on the medial aspect. Dig through some of the fat, connective tissue. So that blue thing is the renal vein. It's heading right to the kidney. If I dig around a little bit, I can get the renal artery. It's just kind of tucked in. All the arteries are kind of tucked in behind the veins. Again, it's heading straight to the kidney. The other vessel is straight down, so that the post cava is going straight up and down.
Oh, okay.
We can come up here. I can see it right behind there, the abdominal aorta, but there's the post cava. I don't do the iliac arteries on the cat, I do them on the models. They kind of do some funny things in the cat. But I can come over to the other side. See, there's the other kidney. The right kidney. If I go down a little further, in here, I can find the renal vein and the renal artery. And the other thing you can find there, it's not on your sheet, but while we're in the neighborhood, that little tube right there, we'll get into it in a couple chapters, but that's the ureter. It comes off this surface, that medial surface. And it's going to travel down to the urinary bladder. So there's his little, and again, urinary bladder isn't on your list now, but we'll do that in the next test. But there's his urinary bladder. And I'm impressed. The things that are healthy about this cat, other than he's dead. But he was quite a specimen. Usually the bladders like that are like a truck driver, long haul truck driver. They're big and they're real thin. And this guy has a nice muscular wall to it. Would think with the kidney problem he wouldn't have he'd have more problems, but he was the boss. Sorry. Femoral vein. We're outside of the pelvis here.
Mm-hmm.
So femoral vein, femoral artery, is like all the arteries, a little bit more obscure, but they're tucked in behind the veins. I think that's the last of the things on the cat, structures on the cat.